Do you know the World Health Organization have declared the Ebola virus as an epidemic of international concern? So this is not a time for you to go about shaking or hugging people unnecessarily. Watch this video today and I'll tell you what to do to keep yourself safe during this epidemic. Also follow, like, subscribe, and switch on the notification bell for you to be the first to get it once I post them. So the Ebola virus, as of 17th of May 2026, the World Health Organization declared this as an epidemic of international concern. And this is time for us to all be alert, watch out, be on the lookout, and make sure that you keep yourself safe. As of 20th of May 2026, 139 persons have died from this virus. Around 600 cases have been recorded of this Ebola virus epidemic. And it could be as much as over 1,000 because it's the first person who showed symptoms of this was around 24th of April in 2026. So it's widely spread across the DR Congo. It's now in Uganda. Basically, those in East or Central Africa are really at high risk at the moment. The Ebola virus is spread by a group of virus, just like the HIV. This one is spread by the auto Ebola viruses. It's spread just by human contact with materials. For people like you who like to knock without or use sharps that has been used by someone else, you are at higher risk. So you need to be on the lookout and be careful. So you need to take it serious because this virus could be carried by anybody who's come from East or Central Africa. You don't know where someone has been, you don't know where they are coming from, so you should keep yourself safe. This Bundibuyo strain of the virus, unfortunately, there's no drug or vaccine that can treat it. That is the more reason that you should keep yourself safer. And the fatality rate of this virus is around averagely 50%. So if you catch them, 50-50, either you go or you stay. So don't take this as a joke. Listen attentively so you can follow these guidelines and keep yourself safe. So what does this information mean to you? If you are listening to me or watching me from Lagos or London, at the moment you are at low risk, but it's your responsibility to keep yourself safe. Don't expose yourself to unnecessary risk. So avoid any contact with people who are returning travelers from anywhere around Central or Eastern Africa. It is widely spread there. Avoid contact with them. Avoid anybody who's presenting symptoms, any kind of malaria-like symptoms or mpox symptom as well, be it a headache, tiredness, muscle ache, high temperature. Just avoid it completely. You don't need to expose yourself to any form of risk that you're not sure of. So that's specialist centers that are in charge of taking care of cases like this, that has been set up by appropriate health agencies. So if you feel like you have any of these symptoms and it's lasted more than 3 days, please see your doctor and you will be referred to a specialist center near you. So how serious is this Ebola virus? It is very, very serious. As a matter of fact, there's a fatality rate of around 50% for this Ebola virus. And the virus have actually been spreading. The first time it was recorded officially was through a nurse that presented symptoms like I said earlier, headache, fever, muscle ache, pyrexia. These symptoms came up. Somehow she died from the virus. So when she died of it, she was taken to her hometown somewhere in DR Congo for her to be buried. The way her corpse was handled, the virus spread around there and it's been dealing with people out there. Our heart goes out to them. While she got the virus as well, an American doctor who is also in the same city where she worked got the virus as well. He's been repatriated to Germany for treatment. So I can't emphasize how important hand hygiene and sanitation is. It can't be overemphasized. At this time, make sure you don't eat any animal that is dead without cooking it properly. Don't fail to call your doctor if you feel like you have any symptoms of malaria or mpox. So infected, sick or dead animals are a no-no at this time. What you need to do is to look out for these symptoms between the 2nd to 21st day after one is infected. The person could present with diarrhea, vomiting, blood in poo, or blood from other parts of the body. Also, around areas where there are lots of primates and bats, as well. You need to be careful how you make contact with animals as well, especially bats. I don't know what the plan is at the moment in Nigeria and West Africa to contain this, if it in any way spreads from East or Central Africa down to the West. But the Federal Ministry of Health and the NCDC, while they're doing as much as they can, you need to do more, because we're hearing of nurses wanting to go on strike in Nigeria. It's just not a good time, and I hope the authorities do the right thing and make sure health workers are properly staffed and on the lookout to help the citizens while this is ongoing. And lastly, practice social distancing. They say prevention is better than cure. Don't even allow the sickness to happen in the first place. Then you start needing to take paracetamol. So just prevent it at first. Health security is everybody's business. Infection prevention and control is our business. It is your business as well. This is not a time to say, no concern me. It concern you, because if that sickness or this epidemic gets to your neighborhood, it's going to clear everybody there, unless adequate measures are taken promptly. Like, follow, subscribe, switch on the bell icon there if you've not done that. My name is Dr. D. I inspire you to live healthy.